In this particular episode, we're going to discuss about goiter and thyroid nodules. Any enlargement of the thyroid gland is called goiter. Similarly, lumps and bumps in the thyroid gland are called thyroid nodules. People can develop thyroid nodules or goiter if they live in areas which have iodine deficiency. Similarly, during pregnancy, there is a physiological increase in the size of the thyroid gland, which usually resolves after the pregnancy. Let us look into the fact that most of the thyroid swellings are not cancerous, fortunately, and that there are various terms that are used to describe these thyroid nodules. To begin with, there is a term called solitary thyroid nodule, which means there is a single thyroid nodule. Most of these are benign, that means not cancerous. Some of them can secrete excess thyroid hormone. Similarly, we do have a term called multinodular goiter, that means there are a lot of nodules in the thyroid. Again, most of these are benign, that means not cancerous. Sometimes these can secrete excess thyroid hormone into the blood. Coming to another term, there is a term called diffuse goiter, that means there is uniform enlargement of the thyroid gland. Again, most of the cases are not cancerous. Sometimes this can be present when there is underactive thyroid gland or overactive thyroid gland due to autoimmune conditions such as Hashimoto's or Graves' disease. There are other benign thyroid problems as well, such as colloid nodule or hyperplastic nodule. We do have thyroid cysts as well, which means that there is fluid within the nodule. Some of these cysts can be cancerous. We do have thyroid cancer as well, presenting in the form of swelling of the thyroid gland. We'll discuss these in another episode. Coming to terms such as hot and cold nodules. Hot nodule means that particular nodule is secreting excess thyroid hormone, and cold nodule means it is under secreting thyroid hormone. These are features found in nuclear thyroid scans. Then you do have retrosternal goiter, which is the term used when the thyroid gland is extending down below beneath the breast bone. So these are the common terms that are used to describe thyroid nodules that you might have heard. Coming to what exactly should you do and how do these present? These can present when you're taking a shower, when you just feel your neck area, or when you're observing yourself in a mirror, or your friends or relatives or spouse or kids might point that there is a swelling here. What are you supposed to do when you get to know that there is a thyroid swelling? You need to see an endocrinologist, that means a specialist who deals with endocrine problems, i.e. thyroid problems for instance, and your endocrinologist would ask a detailed history. For instance, how long did you have this? Has it been increasing in size? Is there any weight loss? Have you got any hyperthyroid or hypothyroid symptoms, that means excess thyroid or underactive thyroid symptoms? Have you got any pressure symptoms, that means difficulty swallowing, difficulty in your breathing because of the thyroid nodule or thyroid swelling? Have you got any change in your voice? And also he or she would ask you about any family history of thyroid cancers, any previous history of thyroid other cancers in your case, or did you have any radiotherapy, etc. After taking such detailed history and examining your thyroid gland, your endocrinologist would run a few tests. For instance, thyroid blood test to see if there is any excess or underactive thyroid hormone levels in your blood. They would ask you to do an ultrasound scan, which is a jelly scan of your thyroid gland, which gives information about the extent of the thyroid swelling and the specific nature of the nodule. Sometimes it also gives information as to whether it can be cancerous or not. Depending on such a test, your endocrinologist might order for a test called fine needle aspiration or FNA, which gives information about any cancerous cells that might be present in the thyroid gland, particularly that nodule. Also, sometimes your endocrinologist might ask for a nuclear scan, which gives information about whether it is hot, that means over secreting, or it is cold, that means under secreting thyroid hormone, and also about the size and the extent of the nodule or goiter. Based on this information, the endocrinologist would come to a diagnosis and may ask for surgery if at all there are any signs of cancer. If it is not cancerous, then it is best left untreated, i.e. without any surgery, unless if you have any pressure symptoms or you find that it is troubling you cosmetically. So leave it to your endocrinologist, who can make an informed decision based on all this information. At times, your endocrinologist might replace the thyroid hormone if at all the thyroid hormone levels are less, or control the excess thyroid hormone levels if at all your thyroid nodule or thyroid gland is secreting excess thyroid hormone. So ladies and gentlemen, I hope now you are able to comprehend what exactly thyroid nodules and goiter can do to you, whether they are cancerous or not, whether you need to get them followed up or not. In most of the cases, they are not cancerous, so do not worry. Even if they were to be cancerous, most of them are curable. So don't worry, but do not neglect if you come across a thyroid nodule or a diffuse swelling of your thyroid gland. Do see your endocrinologist, who can guide you in the right direction. Take care.